Prescription drug abuse. Something we have all heard of, but most are ignorant to the impact it is causing on our nation. Prescription drug abuse has become one of the leading causes of American mortality. Now more than ever, doctors are prescribing more prescription drugs to people who do not need them or are abusing them. These prescription drugs can be abused by the patient, or they could be selling them on the street to make a profit. We as a nation need to find a solution to the rising epidemic of prescription drug abuse. We must limit the number of addictive drugs that are being prescribed because it is taking a serious toll on our nation. It is creating drug addicts, hurting health of citizens, and hurting our economy. Things have to change, or our nation is going to face an inevitable crisis. Any citizen who is prescribed addictive prescription drugs is at great risk of becoming an addict. It can happen to anyone. For example, a teenager who hurt their knee while playing a sport then got prescribed too much pain medicine. Or a grandmother who broke her hip and becomes dependent on medication to get her through the day, even when she doesn't need them anymore. These citizens who become addicts can quickly change their character and behavior. They start putting drugs before their family, work, and other important things of life. These addicts go from pain clinic to pain clinic to get their pain medicine, or they might simply turn to an easy way to get drugs, and that is the street. Going to the street for drugs is very harmful, but it can be a cheaper alternative for the addict. These drugs can be mixed with all different substances that the user may not know of. For example, there's been a large increase in people who are dying because drug addicts are getting drugs laced with fentanyl, a very powerful drug that can cause an overdose. A lot of this could be prevented if there was a decrease in prescribed addictive drugs and an increase in physical therapy. And prescriptions that are prescribed that are non-narcotic, and better health choices made by the patient. These addictive prescription drugs that are being prescribed are not only making addicts, but also ruining citizens' health. The most common addictive prescription drugs that are given are oxycodone, Demerol, and codeine. These drugs can have very harmful side effects. Oxycodone can cause irregular heart rhythm, chest pain, kidney failure, and liver failure, and it can also hurt the brain's ability to adapt to new input. Demerol can cause tremors, low cortisol levels, and mood changes. Codeine can cause difficulty in breathing, confusion, and low blood pressure. Taking these addictive prescriptions long-term can definitely cause health issues in individuals. There needs to be an increased regulation about showing the patient the harmful effects of these terribly addictive drugs. Addictive prescriptions have taken a tremendous toll on our economy. People who become addicted lose their jobs and steal to get what they need. This causes our economy to lose a lot of money due to less people working and more crime occurring. These addicts who have families can cause an even bigger problem for our economy. For example, a dad who is a user can't provide for his family when the mother is left with multiple children to provide for. Therefore, they have to get government assistance for many things, such as healthcare, food, and other living expenses. People who become addicted also can be at risk for an overdose, which can cause unpaid health care for the patient. The prescribed addictive medications are not hurting the patient, but also hurting our nation as a whole. This epidemic has become a popular topic, so hopefully there will be great measures taken to limit the amount of prescribed addictive medication that is being given out. We cannot take a risk we cannot risk a greater rise in addicts, more drug-related health issues, and harmful effects on our economy. There needs to be less pain clinics and a certain criteria or regulation set for how much an individual can use addictive prescription medicine. There also needs to be more options given to patients than just highly addictive drugs. and there are plenty of ways to prevent the prescribing of addictive medication. We can possibly change the course of this epidemic if our nation takes it seriously.